The spread and the standoff, new cases of coronavirus popping up coast to coast, and Washington stalled on just how to respond to all of it. This morning, Democratic leader Chuck Schumer meeting with Treasury Secretary Steve Mnuchin, just one part of intense negotiations over a massive stimulus package that is happening on Capitol Hill right now. A key vote in the Senate scheduled for just about 2 hours from now. Our new reporting on how close or even how far both sides are. We are from a deal with the markets watching all of this.
Our colleagues on the other side continuing to dicker.
He knows darn well for this bill to pass, it needs both Democratic and Republican support.
Now, this hour, we are talking to two senators here on MSNBC, Democrat Chris Coons and Republican Mike Braun. Both of them are going to be joining us live in a few minutes from now. Meantime, President Trump saying he will activate the National Guard in 3 states, also promising more supplies like masks, respirators, gowns. All of it supposedly on its way. Still, some in the hardest hit areas say they still don't have what they need, as the Surgeon General warns this morning, quote, "This week, it is going to get bad." A lot to cover here at home and around the world. Our NBC News team is set and ready to go on this Monday morning. NBC's Garrett Hake is on Capitol Hill for us. Hans Nichols over at the White House. David Gura following what is happening on Wall Street. And we're going to start with Garrett on Capitol Hill. Garrett, you and I have been kind of speaking offline a little bit. A lot of moving pieces, but are we actually seeing this move towards some kind of compromise before noon?
That's certainly the hope. The Treasury Secretary is on the Hill right now, and he's doing what amounts to shuttle diplomacy, going back and forth between the Democratic and Republican leaders' offices, trying to hammer out this massive spending bill that could hopefully be passed through the Senate as early as today. The sticking points that remain, Democrats would like to see more money earmarked for hospital systems, for state and local government, and to protect workers. But the biggest single issue seems to be this $500 billion with a B dollar bailout fund. Democrats think there are not enough strings attached to it. It would essentially allow the Treasury Secretary to spend money at his discretion and not even disclose it for months. So that is probably the single largest hang-up now. But as these negotiations go on, and as we get closer to potentially a next vote here sometime afternoon, things are also getting a little bit chippy. We're seeing Republicans accuse Democrats of putting campaign items, essentially stuffing this as a grab bag full of extra issues that go beyond the immediate crisis at hand. The hope is that this vote that's scheduled to happen sometime in the noon to 1 o'clock hour actually doesn't happen then, that we get an agreement and it kicks off more of a final vote perhaps later today. But we're all watching and waiting for a very small group to make this decision ultimately, Eamon.
Hey, Garrett, don't go anywhere. I want to come back to you really quickly after I speak to Hans and David. Hans, let me get your perspective on this from the White House. The White House is essentially not really clear about where they stand on some of the key issues on all of this. They obviously want this done, but are still waiting for the politicians on Capitol Hill to actually make it happen.
All the signals from the White House, from Secretary Mnuchin, is that they want a deal. They can argue about the details later. That's not to say that there aren't any internal arguments within the White House. And as we're reporting, officials are telling us that there's concern that they may be going too far with the public health restrictions and the kind of damage that will ultimately do to the economy. You heard the president hint at this last night in a tweet, suggesting that the cure could be worse than the underlying problem. And just in the last hour, we had Senator Lindsey Graham, who is usually a pretty good barometer for what's happening inside the White House. Obviously, he talks to the president quite a bit. He's urging the president publicly not to back down from these public health restrictions, saying there, "I hope we do not undercut the decision by suggesting we back off aggressive containment policies within the United States." Eamon, that to me suggests that there is a big debate taking place inside the administration on just how long to keep these restrictions in place. We know where the president was at 6 p.m. telling Kelly O'Donnell that he hopes he doesn't have to extend them, but clearly they may be rethinking that.
It's incredible when you think of what measures some of the other countries have taken and how long they've had to endure them for, whether it's China 6 to 8 weeks, Italy now almost 14 days, and the U.S. Pretty much in its first week, and already the president may be reversing course at the end of those 15 days. We'll talk more about that in a few minutes. But David, let me get your thoughts really quickly. The Fed announcing new measures with the hopes of trying to support the economy. By the looks of it, though, it is not easing the markets this morning.
Yeah, investors have seen this void, this policy void open up in Washington, D.C. They're watching what's happening between the White House and what's happening on Capitol Hill. And absent that, the Fed has really stepped in with monetary policy. What we saw today is kind of incredible. You see the Fed expanding its bond buying and security buying programs, the likes of which we haven't seen since the financial crisis back in 2008. But I think the standout thing beside that in the statement that they issued this morning is what they're hoping to do for small businesses. They're hoping to lend to small businesses, create these kind of stopgap loans that small business owners could defer payment on principal on, defer payment on interest on for the foreseeable future. So this is an expansion of what the Fed has been doing, and most astonishingly, they're saying that they're willing to keep doing this, keep buying debt, keep buying securities, both government and corporate securities, for the foreseeable future to do as much as it takes. But you mentioned the markets going into this morning's trading session. Before the Fed made this announcement, they were pointing to a down open. Investors, still very much curious what's going to happen, very much eager to see something happen with this fiscal stimulus bill up on Capitol Hill.
All right, David Gura, Hans Nichols, thank you very much to both of you. Joining me now from Capitol Hill, Democratic Senator Chris Coons from Delaware, a state that just announced, unfortunately, 8 new cases in the last hour, bringing the total there to 64. Senator, good to have you with us on this morning. Thank you very much for your time. Let me start by asking you, and we're about 2 hours, maybe 2.5 hours away from this scheduled vote. Can you give us a quick check just on where things stand as of right now? Are we going to see any major breakthroughs in the next 2.5 hours?
I'm hopeful, I'm optimistic that the gap between Republicans and Democrats here in the Senate in terms of this big stimulus package have been closed in recent hours, but I don't know that yet. Let me start with what your previous interview just emphasized. There is a huge small business package, $350 billion, that has been worked out fully. This is bipartisan. It enjoys strong support. It will not just provide access to loans. Many of these loans will be grants if small businesses keep folks on their payroll or rehire folks onto their payroll who've just been let go. That's going to move very quickly, and that'll put some badly needed cash in the hands of small business owners, sole proprietors, nonprofits, folks that are absolutely critical to sustaining our communities and supporting our local economies. But there's some key differences that were not resolved as of last night. Support for state and county governments. That's who often employs the frontline public health workers, the paramedics, the folks who drive ambulances, the orderlies and the nurses in public hospitals. That was a gap that needed to be closed. And most critically, some transparency, some accountability around how this $500 billion Treasury Secretary-driven big corporate bailout fund is going to be run. My advice to my leadership is going to be, if we can't close the gap on the accountability and transparency of that big $500 billion fund, let's take the rest of this and pass it. The payments to individuals, the support for small business and nonprofits, things that'll put a floor under our economy, and in particular, the big expansion of unemployment insurance. There's lots of parts of this bill that have been worked out on a bipartisan basis. We should be able to get this done today.
Let me go just through some of these points really quickly, and I want to get to a few of them, so I appreciate your time for this. But you're saying, walk us through some of the sticking points on the state and local governments issue that you've outlined. I mean, what is it that the Republicans are saying? They don't want to get money to state and local governments to address these ambulance drivers and others that you're saying you want to try to help? I mean, why would they also be against accountability and transparency, as you're putting it?
There was some concern that I heard from senior Republican senators that county governments and state governments would simply use these federal direct transfer funds to help fix their longstanding pension problems. I said, fine, put a restriction on it. Say that these funds can be used for COVID-19, for the direct impact on state and county budgets caused by the collapse in their sales tax receipts, the deferral of their ability to collect on personal income tax. When we push back by 2 months, the federal income tax, that pushes back most states by 2 months. And the dramatic increase in costs they're seeing for overtime and for public health workers. Fine, we can work this out, but there was not enough in the bill, at least as of last night, to support state and local governments. Counties and cities are bearing most of the burden of the immediate direct response, and states are going to be absolutely critical partners. If we don't backstop those governments, they won't be able to provide the support to our communities that we expect them to provide. This is why we have a federal government. Federal federal employees don't directly provide the immediate response to disasters. State and local government employees do. And then the federal government comes and provides the financial support after the hurricane, after the tornado. This is no different. This is a global pandemic where the folks we expect to be out there today who are actually risking their lives to save other people's lives are often public employees employed by cities, counties, and states.
Senator, let me ask you really quickly about something my colleague Garrett Haig brought up. You may have heard him. They're talking about it. The charge of Republicans are saying this is pretty much an election grab bag for Democrats. They're trying to ram in things that have nothing to do with the COVID-19 response. For example, canceling student debt loans.
I'll say this, some support for the semester delay that's going to happen in terms of student debts and support for higher education in terms of colleges and universities, those that don't have significant endowments. I do support that. I do think that we frankly need to make sure that the investments that we're going to make in our community through this bill directly support the workers, the families that are going to be most directly affected by COVID-19. We ought to focus on that menu and not on things beyond that. Both parties need to put down the partisan tools, quit the bickering, come to an agreement around things that will support our country in this pandemic crisis. And I frankly stand with the Democratic caucus on our values and our priorities in this bill. But at the end of the day, there is a lot of pressure on us to get this done today. That's why I think you'll see movement.
Let me, sir, get your final thoughts on Senator Rand Paul, a colleague of yours. He is now the first senator to test positive. But before he got the results back, it seems that he went to the Senate gym Sunday morning.
Yep.
He was out and about for the past week. We're not clear yet. We have not gotten an answer from his office as to when he actually took the test and whether or not he did any measures between then and getting the results yesterday. Your colleague, Senator Kristen Sinema, called that absolutely irresponsible. Did he put other senators at risk with his behavior over the past week or so?
Well, I'm not going to leap to that criticism. He is a physician. He's an ophthalmologist. It certainly seems as if it was irresponsible if he knew he might well be positive and was still going to the gym and interacting with folks. But at this point, we've got lots of other more pressing issues that we could be trying to resolve. I do think one of our core issues is voting. Voting here in Congress, we don't have a provision that allows us to vote remotely, so we are social distancing. Most of us are spending most of our time alone in our offices and using phones to communicate with each other or email. But we also don't have a provision that ensures vote by mail in November. Now, some might criticize that as a electioneering provision, but I think it's essential that this stimulus include funding and authorization for vote by mail, given that we've already seen 6 major states delay their presidential primaries. We need to ensure the American people that the November election will happen on time. We did this during the Civil War. We did it during the Second World War. We can vote during November, regardless of whether this pandemic is fully resolved by then or not.
All right, Senator Chris Coons, sir, I appreciate your time. Thank you very much for joining us this morning.
Thank you.
All right, let's head now to the front lines of this pandemic, where despite government promises, healthcare workers say they are still in dire need of protective gear, and that time is running out. NBC's Gabe Gutierrez is in New York City for us, which is now, by most accounts, the epicenter of the pandemic. Sam Brock is in Houston at the world's largest medical center. Gabe, let me begin with you. The mayor of New York City saying we're about 10 days away from running out of PPE, critical supplies like masks and gowns. What is the reality on the ground right now?
Hi there, Emil. Yes, as you mentioned, New York State now has about 5% of the world's confirmed cases. Behind me is a pre-screening tent that started checking patients last week. Last week, we saw a line starting to grow. The numbers have continued to soar. And yes, as you mentioned, New York City Mayor Bill de Blasio saying this city is just a few days away from its health system being overwhelmed. A massive hospital, New York Presbyterian, says it's burning through about 40,000 masks a day and expects to be going through about 70,000. Now, New York's Governor Andrew Cuomo yesterday ordered hospitals to expand their capacity by 50%. There are also 4 sites here in New York, including the massive Javits Convention Center in Manhattan that will be outfitted to increase bed capacity as well. Now, the president, Eamon, as you have mentioned, he's been reluctant to use the Defense Production Act to order companies to make more medical supplies. That's not sitting well with many doctors on the front lines. The president has said that he doesn't want companies being nationalized, and that private companies are stepping in regardless. Companies like GM, like Ford, and Tesla that are offering to make respirators. Companies like Haynes are offering to make those masks. And also 3M Corporation says that it is ramping up production of millions of masks. New York City is expected to get a shipment today. But Governor Cuomo says the situation is dire, Eamon. He says that New York State could require more than 30,000 ICU beds at the peak of this crisis. And right now, we only have about 3,000 ICU beds, Eamon.
All right, Gabe, let's cross over now to Texas, where Sam Brock is. Sam, bring us up to speed on what the state of Texas is doing and what you're hearing from healthcare workers there, as we mentioned, at the world's biggest medical center.
Yeah, we're on this sprawling campus here this morning, and good morning, Eamon. As Gabe was just describing, it's not like the brink of capacity in New York. They're still having reasonable flows here in Houston. You'll see activity behind me right now. There's 4 major hospitals, 24 facilities here. I've been talking to doctors and nurses, healthcare workers coming through here. What they tell me is that from a supply and staffing standpoint right now, they are okay. The concern is what this is going to look like in a couple of weeks. And I was talking with an ER doctor who told me that if staff were repurposing N95 masks and other PPE before this pandemic happened, they would be referred to their medical boards and likely fired. But now, because of conditions here, obviously the strain really taking its toll, completely different circumstances. The governor of Texas, Greg Abbott, took a couple of measures yesterday to try to create more hospital beds. One of them was allowing multiple patients in each room. Another banning all procedures that are not medically necessary and life-saving. But be that as it may, many people here, doctors specifically, concerned about guidance and direction as they have to increasingly make more difficult decisions. Here's Dr. Donna Kim Murphy, a neurologist locally, who wants a seat at that table in these conversations.
You know, the ethical challenges are pretty profound when you do have limited resources and you're forced to ration, to make those decisions on who lives and dies. That's not something that any provider wants to have to decide in the moment. We want some guidance there, right?
And here in Texas, there has not yet been a statewide stay-at-home order or shelter-in-place, as they're calling it in Dallas, which they just implemented as of today. Houston could be next. We are waiting, Eamon, to see what the state might do in terms of more pervasive measures. Back to you.
All right, Sam Brock live in Houston, Texas for us. Sam, thank you very much. A grim update this morning. The World Health Organization says worldwide the number of coronavirus cases has topped 242,000 with 9,800 deaths. That includes new cases as the global pandemic emerges in the Gaza Strip. Officials there fearing the virus could run rampant in one of the most densely populated places in the world. In Europe, Germany's Chancellor Angela Merkel is in quarantine after her personal doctor tested positive, but there's hope from Britain's Oxford University. Researchers there telling NBC News they may have a vaccine within 6 months. Other vaccines are in development in the U.S., China, and Germany. And U.S. medical gear has arrived in Italy as cases there continue to spike. 59,000 sick with nearly 5,500 deaths, including 800 deaths in one day alone. Now the mayor of one northern Italian city has this dire warning. The death toll there might be 4 times higher than officials are claiming. NBC's Matt Bradley is in Rome for us. Matt, good to have you with us. I know that you spoke with this mayor. Where do his dire concerns stem from?
Yeah, I'm in the mayor of Bergamo, Giorgio Gori. He told me that it could be 3 to 4 times the number of deaths as has been officially reported, as you just mentioned. And the reason why, it was his informed speculation, we can call it, because a lot of these elderly people who were infected with the disease in his city of Bergamo died alone, without medical attention. They died of natural causes, or they died of pneumonia back a couple of months ago, before it was entirely clear that this disease has taken such a stranglehold over his city. And, you know, the way he described his city, it was really heartbreaking to hear, Eamon. I mean, the streets are just void of people. Everybody's inside. And one of the reasons why it hit so hard was because doctors underestimated the extent to which this disease had already taken hold. And as you can see, you can hear in the background, there's already ambulances that are coming here in Rome. This is Rome's largest hospital behind me. It's been seeing a lot of COVID-19 patients. But he's mentioned these drivers here, these medics are in their full PPE pulling in right here. So it's a real dire situation, even in Rome, which is far south at the heart of this infection. But, you know, some of my colleagues at Sky News, they actually went into a hospital, not in Bergamo, but in Cremona nearby. And it was a very dangerous mission for them, and I applaud them for it. But you can see some of that footage, just how desperate it is for the medics, how much protective gear they have to wear, which is what you were just discussing in the last block. How difficult that is to come by. Here in Italy, we've already seen well more than a dozen nurses and doctors killed from this disease, and many of them are well outfitted with equipment. And for them, it really is so dangerous. You can see in some of this footage, they're trying to keep away from the patients because they require such intensive care, but every couple of hours they have to get on top of them and flip them over. And that is what is so dangerous for all of these medics. Eamon?
Yeah, I'm sure, Matt, you've seen those images of the doctors in Italy taking their masks, their protective goggles off, and seeing the bruises around their eyes. A lot of those pictures going viral, kind of telling the story of how long and how hard they have all been working. Our thanks to them and everyone else on the front lines of this. Matt Bradley live in Rome for us. Thanks, Matt. Welcome back, everyone. I'm Ayman Mohideen. Still no agreement in Congress on an economic stimulus bill. Democrats say the proposal from Republicans does too much to bail out big businesses and not enough to protect workers. Another procedural vote is set for noon, about 2 hours from now. Adding to complications, Senator Rand Paul testing positive for coronavirus over the weekend. That's prompting several other senators to self-isolate with no way to vote remotely, believe it or not. Over at the White House, President Trump saying he's activated the National Guard in Washington, California, and New York. We are watching all of these developments, plus this any minute now. Florida's governor will speak at the opening of a new testing site at the largest retirement community in the country, just north of Orlando. That is where we find NBC's Kerry Sanders. Kerry, good to have you with us. Florida really in an interesting dilemma here. We've all seen the images now coming out of Clearwater, Florida, but today they're about to unveil this testing center at the largest community there, retirement community, I should add. What is it looking like there right now on the ground?
Well, it's already that their line is building. Let's take a little understanding of what's going on, because a lot of people have been scratching their heads when they look at Florida. Population 21+ million people, 20% of the population here over the age of 65. The Villages, the largest retirement community in the nation with 115,000 residents. But when you look at the total number of 1,007 coronavirus victims in the state, it seems a little confusing. But there's a reason behind the math. Those are people who have gone to the hospital and gotten tested. The testing sites like the one that's opening here at the Villages, the one that's open in South Florida now, those are only just getting up and running. And so we don't have the test numbers to show how many people have coronavirus, only those who have gone to the hospital and are ill. So what we may see in the coming days, 48 to 72 hours once the tests come back, that number explodes, especially in a state like this. Governor Ron DeSantis is trying to open these testing sites as fast as possible, but just down the way in Orlando, they had promised one would be open today. It's a pretty major urban area in the state. It's still not going to open today. It may open on Wednesday. Getting all of this up and running, like just about everywhere in the country, has been slow going, Eamon.
All right, Kerry Sanders live for us just north of Orlando. Appreciate it. Thanks, Kerry. Also this morning, the Surgeon General gave us an update on the U.S. response. Here he is with my colleague, NBC Savannah Guthrie, on the Today Show.
Every single day counts. Every single second counts. And right now, there are not enough people out there who are taking this seriously. And you just see it looking in California, people on the beaches. You see it in Washington, D.C., the people out looking at the cherry blossoms. We need to take this seriously.
We've talked a lot about that graphic. Everybody's seen it now about flattening the curve. This is the effort we're all collectively involved in right now. If we're not testing as much as we could be, how will we know? I mean, what's your progress report on where we are on flattening the curve when you have places like New York State saying, we're not testing you anymore unless you come in here to the hospital? So if you're not testing, how will we know if these measures are working?
Well, that's a great question, and I had a tweet out yesterday where I pointed out last week, if you look at Monday to Friday, testing increased by tenfold. Testing is definitely significantly increased across the country. Here's the problem. We aren't testing the people who are at highest risk right now, and it's why yesterday you heard the Vice President say, and you heard me say, that we need to make sure we're prioritizing testing for our healthcare workers. We need to take care of the people who take care of the people, for people in hospitals, and for people who are at highest risk right now. But as Tony Fauci has said many times, and people have heard me say this too, everyone needs to act as if they have the virus right now. So test or no test, we need you to understand you could be spreading it to someone else, or you could be getting it from someone else. Stay at home.
In New York, the governor, New York's the place where they have the most cases right now in this country, said more than half the cases they have right now, 53%, were actually young people between the ages of 18 and 49, which of course is very different than the earlier understandings of this virus. Are young people more at risk than previously thought?
Well, so far the demography definitely seems to be very different in the United States versus in other countries that saw this hit earlier, and we're looking into that. There are theories that it could be because we know we have a higher proportion of people in the United States and also in Italy who vape. We don't know if that's the only cause, but it's important for young people to know you can get this disease. You can be hospitalized from this disease. You can die from this disease. But most importantly, you can spread it to your loved ones. I will not rest. I have not rested. I won't rest until we make sure the people who are taking care of the people get what they need to stay safe. Now, you asked about the Defense Production Act. Here's the thing that people don't understand. You don't need to compel someone to do something they are already doing. We talked to 3M. We talked to Honeywell, and they are at max production. We're working with Haynes. We never would have thought, if you'd invoked the Defense Production Act, to go to a Haynes. And so we're really relying on people to do what they're doing, but you don't need to compel people to do what they're already doing.
All right, let's bring in MSNBC science contributor Joseph Farah, virologist and epidemiologist. Joseph, great to have you with us. Is there a bit of a disconnect from what you are hearing from the country's Surgeon General and the reporting on the ground, including from what you're hearing from members of the medical community in terms of not just the tone about the supplies, but also where we're seeing the country as a whole, those that are abiding by the shelter in place and the various guidance, and those that are still on the beaches and out and about?
I mean, there is a disconnect on every single level. If you just go back to like the earlier comments that were made, the president doesn't deploy the National Guard. It's the governors that deploy the National Guard. Rand Paul, if you're trying to set an example of what not to do, you just did it. By the way, he's a medical doctor. Right. You can forgive someone that would be ignorant of a virus, but he is an MD. So the fact that he went about his business as normal, potentially infecting, many members of Senate and possibly shutting down our government at the time when we need them most is just, I'm speechless at that. As far as with regards to the Defense Production Act, 3M and Honeywell, yes, they make those products already, so it's normal that they would ramp up. You invoke the Defense Production Act to get companies that normally wouldn't make those products to make them, and we're still not doing that. We invoked it, but we're not using it. So this is epidemics in general are something where you have to use every single tool at your disposal. Diagnostics is step 0, personal protective equipment for your healthcare workers, step 1, and step 2, massive public announcements and campaigns, right, just to get everyone on the same page. Right now, that's obviously not happening.
Yeah, so let me just hone in on that one really quickly, because obviously we don't live in an authoritarian state or society like China that could just shut everything down. And it's kind of baked in our DNA that we just don't always do what the government tells us to do right away. And here they are coming out and saying, please stop this. People are obviously not listening to it. In some cases, they're deferring to local states and counties in Florida. The local officials there are not doing it. At the end of the day, realistically speaking, what do you think the federal government should be doing to actually prevent this from happening?
I think it has to be a mandatory 14 or 15-day shutdown of all non-essential services. That way you don't have any reason to go out and congregate. Pharmacies, groceries, hospitals, obviously those have to stay open. But anything else needs to be shut down, because if you're doing it in one place and not in another, that's not how epidemics work. They just keep on spreading and spreading and spreading. So you can project what a 14 or 15-day shutdown will do to an economy. You cannot project how much this will devastate an economy if you let this go on month after month after month, which is what we're doing now. And the fact that the Senate has not yet passed a bill in weeks of debate, that they took banking failing more seriously than they take the entire country failing, it says a lot about where we are as a government right now, be it the White House or our elected officials. I mean, this is a time where you have to make a decision. Pass the bill now and get started on the next bill. If you can stay on the floor all night to talk about impeachment or banks or something else, you can stay on the floor all night and discuss this until you get a bill signed.
Luckily, we have with us coming up a senator who is involved in those negotiations. Joseph Fair, thank you very much. I appreciate you joining us. Let's bring in Republican Senator Mike Braun of the state of Indiana, serving both on the Budget and Health committees. Senator, thank you very much for joining us. I know you've had a very busy night and busy morning as well. Can you just really quickly bring us up to speed on where things stand from your perspective? Are we likely to see a vote at 12:30? Have we closed some of these gaps?
So I think we are going to have a vote, and I'm hoping it's a sequence of 2 or 3 votes. That would tell me that we've really arrived at some type of agreement, because if it's one vote, it's probably a procedural vote that's going to take more time to flesh it out. We do not need more time, because all of us agree small business owners and the wage and hourly workers that were displaced by what was done early to tamp the disease down need to be priority one. It's bigger than that now when it comes to what we're going to need to do to keep the entirety of the economy in motion. And the sticking point, which I think we need the liquidity there for those larger businesses. And I'm having trouble understanding, with some of the restrictions we put on access to that liquidity, why the Dems are maybe quibbling about it. But all I know is when we took the version on phase 2, we took the House's version, didn't like all of it. In fact, Senator Johnson, Sass, Scott and I and others had an unemployment insurance plus up that is exactly what the Dems want in this, and I agree with that. That's probably the most direct way to get money to people that need it. We need to get this across the finish line. The public deserves it. We've caused it by trying to tamp the disease down, and we knew there was going to be pain, but if we do everything on the disease side correct and we get this bill out the door, I think we can get by with less carnage on the economic side.
All right, so let me ask you really quickly about some of the sticking points. You probably saw your colleague, Senator Chris Coons, on the air earlier talking to me about what his concerns are. One of the biggest issues is this $500 bailout that is going towards big businesses, towards corporations. No oversight whatsoever. They're using the term slush fund to obviously characterize it, saying it's going to be in the hands of the Secretary of the Treasury with absolutely no transparency or accountability how that is going to be spent. And they don't want that money going back to corporations that have mismanaged some of their profits over the last couple of years. What do you say to that?
And I agree with that. And instead of a slush fund, it's an access to liquidity through loans. So whoever's going to access it would have the need for it, and knowing it's a loan that you have to pay back. And yes, even when you get those funds through a loan, you should have restrictions based upon, and I'd be in agreement with that. So I'm more worried that we've got other stuff that you don't hear about. Like I heard some money for infrastructure, something to do with Social Security. Those are policy issues that we'll get to once we get through this crisis. So most of us, including Chris, I don't know how much inside information he's got. All I know is all the members, and I worked on the Small Business Task Force, Democrats and Republicans, up until late yesterday, we all thought that it was together. And then the dynamic that changed, I think, was from leadership. It could be valid what they're trying to rectify. I hope it's not politics.
Let me ask you also, sir, about, the money that is going, and here's the problem with this, is nobody has really seen the bill except members of Congress, except for what has been leaked. So it's really hard to gauge this, but is there
Even our staffs have not been through it fully. So, yes, but go ahead.
So how is anyone supposed to have a realistic understanding of what is at play here if the public doesn't know whether or not any money is going to go to people in the gig economy, staff workers, freelancers, people who actually make up the backbone of this economy, but don't know if they're going to get any of that money?
Everything I understand, and that's through working on one of the task forces, all of those subjects were discussed. And there's stuff in it for everyone because we've tried to, because the government caused this by trying to tamp the disease down, which we know needs to be done. Until it's flattened, I don't think you're going to allay the true fear and anxiety out there. But all of that stuff has been covered, and if it's not, we can come back and either technically correct or do something down the road. So to me, it's important that we get it out the door today because that's what the American public is expecting.
And let me, sir, finally ask you about President Trump's views on this, and just to see if you're on the same page as him. He is saying the cure should not be worse than the disease in a tweet that was sent out last night. He's been retweeting this morning. A lot of people starting to make the argument, reopen everything, even if it means the public health crisis that we're seeing. Do you agree with the president with his thinking on that?
We do not want to kill the economic patient as we're trying to rightfully tamp this disease down. After the 15 days, and I think that's next Monday, we need to do what you do in any crisis. Take all the cumulative information we've got and try to make an adjustment then. And if that means in densely populated areas, we need to have stricter controls or either extend them, yes. Because until you actually see the ticker tape starting to go down on cases and mortality, that's going to be the true cure for it. But yes, it's also true we got to be careful that we don't do blanket things that may not be necessary in less densely populated states. So we just need to be smart about it. And I hope that's the point he's making.
All right, Senator Mike Braun of Indiana. And while you and I were speaking, sir, we got word from Senator Amy Klobuchar, not her, but her husband. And you see the tweet there. She tweeted out that her husband now has been confirmed to have the coronavirus. She said that she loves him, and not being able to be by his side is one of the hardest things about this disease. So many are going through this and much worse. Senator Mike Braun, thank you very much, sir, for your time. I appreciate it.
You're welcome.
The Senate GOP stimulus plan also sparking pushback from airline companies and employees. CEOs of major airlines warning of mass furloughs without worker payroll protection grants. As the president of the Association of Flight Attendants, Sarah Nelson, writes this: the coronavirus is a financial catastrophe for aviation, dwarfing the economic effects of the Great Recession and 9/11 combined. Our industry will collapse in weeks without government help. Sarah Nelson joins me now. Her union represents 50,000 flight attendants across 20 airlines. Sarah, thank you very much for joining us. You know, just give us really quickly your biggest sense of, like, your biggest issues with the version of the bill that Republicans put forward over the weekend that, quite honestly, no one has exactly seen yet.
Sure. So actually, we don't have to spend a lot of time on it because the vote that the Democrats took yesterday was heroic and stopped it from going forward. What that plan would have done is it would have bailed out the corporations and given them the ability to balance their needs and lay off workers, put people out of work, cut their pay and benefits while the executives continue to profit. So that is what was stopped yesterday with the unanimous vote by the Democrats. And now what we can do is talk about what this country is saying. We can no longer have corporate bailouts. We need relief packages that are for the frontline workers. And that is the plan that we have put forward. So now that is what is going to be on the table.
What does that
and
entail
what this
exactly?
Does is it provides, sure. What this does is it provides direct aid from the government to the companies to pass right through to the workers on the front lines and their paychecks. For the first time in history, we'll be telling corporations how to spend that money, and it has to go directly to the people on the front lines. That keeps them in their jobs, it keeps them getting their paychecks, and it keeps them connected to their health care. This is critically important because as our medical personnel are out there trying to flatten the curve of this threat of the coronavirus, we need to make sure that the focus is on them. The rest of us can safely shelter, and also that the airline industry can stay strong and not be making decisions about cutting areas of the network that wouldn't get to small communities. So remember now, people are stuck in their homes. The airline industry provides critical service to our small communities. The mail
Sarah,
is carried on our planes.
I'm so sorry to interrupt you.
People need to get
Sarah,
prescription
I'm so sorry to
drugs.
interrupt you, but we just want to take a listen. Okay, it looks like we're trying to get a shot of Andrew Cuomo, governor of New York, who's about to start briefing reporters. So I just wanted to let you know that if he does come up, if he gets that shot back up, we are going to take it. But let me just kind of bring you back into the conversation really quickly,
Absolutely.
if I can. And apologies in advance if I have to interrupt you. But what will happen if those things don't make it into the bill? Because I also read in your piece that obviously you had expressed concern about the cash and the profit that these companies had been making over the past 10 years. All of that went into stock buybacks and not preparing for a rainy day like we're in right now.
That's right. So we need to restructure. We can't go back and fix what happened before. We need to take care of the people on the front lines right now. And then we need to say, you can't do these things again. So the other restrictions that are included is no more stock buybacks, no executive bonuses, no dividends, no break-in union contracts. And so all of that is in the Democrats' plan. And frankly, that is what is being echoed by the White House. So it was Mitch McConnell that's been standing in the way of getting this done. And now, because the Democrats took a firm stand, I believe that we're going to be able to get to a place where we can actually have a package that has workers first. And that is what we are pushing for. And this is really historic that we are saying we're going to put together a relief package that tells these corporations exactly how that relief has to be directed. It has to be directed back to the workers, back to the taxpayers. This is opening up the Treasury to make sure that the taxpayers, the people on the front line, the American public is taken care of here. And this is what we're promoting in the airline industry. We believe it can be a roadmap for everyone else.
All right. Thank you very much, Sarah. I appreciate your time and your input on all this. Sarah Nelson, we're going to cross over now to that news conference from the governor of New York, Andrew Cuomo, giving us an update on the coronavirus pandemic in New York. Let's take a listen.